Hey everybody, it's Friday, February 15th, and I had a chemo appointment yesterday. I also wanted to give you an update since my last video, since it's been a week. The day I made the video, I said I kind of felt a little groggy and a little under the weather. That only lasted about a day, and it's funny how I said I didn't feel all that tired, but I ended up crashing that night for a solid 10 hours, so definitely was tired. But for the rest of the week, I felt pretty good. One of my coworkers had made the comment of that I look the best I've looked in months with, the lymph nodes going down, just having energy again. So that was also pretty good. So yesterday was chemo appointment number 2. It went really well. My stepmom came along with me. First I had to do blood work, so they attached the port and got blood work. They had a little bit of problems with it, with flushing it out. The nurse said it was common. It probably will happen 3 or 4 times during the lifetime of a port. So to clean it out, they had to kind of make me do a little bit of a dance. They were like, all right, put your one arm up, put your other arm up, cough, lay back, and eventually it got going, so it wasn't too bad. We then met with the doctor, which was for the most part pretty good news. He was happy with the progress. I haven't had any night sweats or fevers or any issues like that, so that was all good news. They seem pretty happy with that. The lymph nodes really have gone down, and they were happy about that it was a good sign. He did say that I might still be able to feel them because there'll be scar tissue left over, but he said that'll clear out within a couple months or so. So might still be able to feel them. That doesn't mean that there's still cancer there. It just means that there's scar tissue. They also got my blood work back from that morning, and it kind of had mixed results in it. The first good news was that as the cancer breaks down, it creates lactic acid. They gave me a drug to take for that, and they said the numbers for that were really low, and a good sign that the medicine's definitely working. They think once the prescription fills up, which was 30 days, or runs out, I won't need to refill it. So, and then they also got a count for my blood cells. So the first one was my red blood cell. It was in normal range, which was good news. The next one was for my platelets. They said it was really high, which the doctor said wasn't unusual, and he said it's actually a good thing that it was a little on the high end. What happens is, from the last video when I was talking about how I hit the dip, when it shot back up, it just overshot, and he said it's not a big deal on that. The next one wasn't such good news. It was my white blood cell count was below the threshold, so they have a threshold of 500, where if you drop below that, they might need to stop chemo. It was at 400, and they did research to look into what the risks were to continue going on instead of waiting. And they said the risk was pretty low for, high white blood cell count, normal red blood cell count, and everything else. So they decided to, as Dr. Reed had put it, forge forward. Connie did go over a whole bunch of, additional things that I need to do now because there is a risk with that blood cell count being so low. They were like, wash hands, wash your hands, wash your hands. And then she was going over things that I probably shouldn't be doing, and one of them was go to large crowds, which was kind of funny because the night before I went to a Pens game, and her response was, well, you didn't get sick then. She's just saying there's an additional risk to this, so you might want to consider not doing stuff like that. Which, by the way, thank you for those tickets. That was an awesome game. And then the other thing was, fresh vegetables. They said don't eat fresh vegetables and fruits. Make sure that they're cooked. And it was like, well, I ate fresh vegetables yesterday. And again, her response was, yeah, you can do it. There's just a risk associated to this stuff. So she definitely just stressed mostly wash your hands, wash your hands, wash your hands. But also, if I feel at all under the weather, like if I get a fever at all, I need to go to the emergency room or into the Hellman Center as fast as possible. So fun. So overall, it was good news. It just, good news overall. And then For the chemo appointment, it went well. It was really busy at the Hillman Center, like really, really crowded. All the nurses were saying it's the most crowded it's been in a long time. There were lots of people there. The chemo appointment went fairly well. My nurse was awesome. They were able to get me in and out faster than last time, mostly because last time they had to do the allergy test. So I was there for, I think, 2.5 hours, maybe 3 hours, which I do have to thank the Lions for the idea of getting comfy chemo pants. So thank you guys for those pants. Those are awesome and they are very comfortable. The appointment went quickly. No, I mean it was a lot quicker than last time. Afterwards, I felt really tired. Took a nap. I went out to dinner with my parents for Valentine's Day, so that was fun. And then just went to bed early last night. Today, feel a little out of it, but not as tired as last time. Last time I was really, really tired at this point and not feeling that. Feeling okay, a little sore, groggy, but not as tired as last time, so that's good. Then the last bit of news is my hair has started falling out. So I decided to be a little more proactive with it and just shave it off. But I'm gonna have some fun while I do that. So a couple friends are coming over. My one friend wants to know what I look like as a blonde. Another friend wants to know what my hair looks like pink. I want a green mohawk. So the next video is going to have some entertaining clips of all of that. So next video should be pretty funny. Kind of actually looking forward to this. This will be fun to do. But that's the update for now, and I'll keep you in the loop on what's going on. Alright, bye.